There's no way really to know if I had it. I'd never had a scan of my brain before.
Being in the right place at the right time.
Very blessed that I got here in time.
I'm going to look at your wristband.
Some people consider it sheer luck, but for Deborah Railton,
Almost 50% of people don't even make it to the hospital.
being in the right place at the right time saved her life.
Again, please.
6 years ago, Deborah had an aneurysm.
I had the worst headache of my life with pain down my neck, went to the ER and was medevaced to Harborview.
She was quickly rushed into emergency surgery at Harborview to stop her head bleed.
And I realize I'm very blessed to be here in the Northwest. And, I think it's part of the reason that I think it saved my life.
Deborah's lived a mostly normal life up to now. But during a routine checkup this year, her doctor noticed something.
Rather unusual case of a late recurrence of a previously ruptured coiled aneurysm.
Dr. Michael Levitt is a neurosurgeon at Harborview Medical Center. He first treated Deborah in 2018.
She's doing fine, but to prevent the aneurysm from growing larger or potentially bleeding again, we're going to do a second treatment today, an elective aneurysm treatment today.
This second treatment was done in Harborview's hybrid operating room.
The hybrid OR contains the most cutting-edge version of the biplan angiography equipment that's needed to do a procedure like this safely and effectively. It also functions as an operating room.
In this case, using technology in the hybrid OR, Dr. Levitt put a catheter into Deborah's wrist and used in-room imaging to place a stent to treat the aneurysm.
The treatment, it was hands-on, continuous.
Thanks to the work of Dr. Levitt and the team, Deborah can now go back to what she loves doing best.
Lots of grandbabies,